Hi, I'm Anthony Johnson. This is my girlfriend Natalie, and she will be my subject for my physical assessment. Um, Earlier, Dr. Bauer, of course, CC'd you in the email to me, letting you know about my exposure to COVID-19 a day while I was at work. So one of the things that I had to leave on the unit and not bring home was my stethoscope. So when it comes down to auscultations, I will be mimicking those skills instead of actually having the stethoscope, of course. Um, yeah, that's about it. So without any further ado, I will perform hand hygiene. I have Germex here. So I'll do that, of course, when I enter the room. I'll perform privacy checks. Of course, I'll greet the patient. Hello, I'm Anthony. I will be your nurse for this evening. How are you?
I'm good.
You doing good?
Hmm.
Good deal. Are you in any pain at the moment?
No.
You are not in any pain at the moment. Are you in any discomfort? Anything you want to tell me about right now?
No.
All right, good deal. Okay, so gathering all the equipment, I'm putting on my gloves. And of course, I did perform privacy checks. Safety measures are in place, and we will get started. Okay, so first thing to do, I will assess your, level of consciousness and things like that. So, can you tell me your name once again?
Nathalie Turnquest.
Okay. Do you know where you are?
I'm in my bedroom.
You're in your bedroom. Okay. Do you know what time it is? Time of day?
Evening.
It is evening. Okay. And do you know the situation?
I'm being assessed by you.
Good deal. That works. All right. So now we will assess your head, hair distribution, facial symmetry, things of that nature. Everything is in working order. Face is symmetrical. No deviations of any sort. All right. We can now inspect your eyes. Just look straight ahead for me. Pupils constrict. When the light hits, I'll get out the way. She informed me that she couldn't see. All right. Can you follow my fingers? Up, down, to the side, and to the side. All right. We are good to go. Pupils equal and refractive to the light. We'll inspect your external nose. There are no structural abnormalities, no deviations. She does have a former piercing right here that's just no longer there. I will go in with the pen light to inspect the nares. They are pink and moist. There are no polyps or anything like that. You're good to go. Are you able to breathe out your nose okay?
Yeah.
No issues?
Nope.
All right, next I'll inspect the lips. So, lips are pink and moist. Everything's good. If you can open your mouth for me, I'll go in with the pen light. All right. Oral cavity is pink and moist. I don't see any dental issues. Hard palate, soft palate, everything's good. Stick your tongue out and say ah for me.
Ah.
Okay. Uvula is there. Uvula's present. Everything's good there. All right. Good deal. All right. So we'll go for the ear this time. Physical perspective, everything seems fine. No abnormalities. She does have piercings. One earring there. One hole there. Excuse me. Over here, we have piercings as well. She has a third piercing in here.
Pick up.
Inspecting the auditory canal. Everything seems clear. Back to this side. Everything is clear there. Okay, do you have any issues in your throat or anything like that?
No.
Okay, no issues in the throat. All right. So now we head to the cardiovascular portion. So we're going to palpate the carotid arteries. Those are present. Okay. Now, at this point, I would have my stethoscope. Of course, put it here on and whatnot. So, well, first I would palpate for the point of maximal impulse, the apex. We're good there. Okay, so stethoscope here. We'll go for the aortic. We'll go pulmonary. Herb's point. tricuspid. And then down here we have the point of maximum impulse, of course. All right. You're gonna put your arms out for me. Get your radial pulses. They're both present and equal. All right, you're good there. Respiratory. So inspecting the chest wall, the outer chest wall, everything seems normal. I have my stethoscope. I'll auscultate the anterior chest, all the breath sounds. I will auscultate the posterior chest, those breath sounds. And of course, I would ask her to take a deep breath for me as I'm doing the auscultation. Thank you so much. All right. Respirations do seem even and unlabored. If you can sit here and just breathe for me while I inspect that. Good, and there's no use of accessory muscles. Good deal. All right, and do you have a cough?
No.
Okay, and you are using room air, so there is no supplemental oxygen use.
No.
Good deal. All right, so upper extremities. Everything seems normal. You want to hold them out for me? There's no pain in these at all?
No.
Okay. So we're going to do some range of motion. We're going to do active range of motion, which means you're going to do it. So, okay, so we're going to do various things. So follow my instructions. So hold your arms out. Keep them above your head. Back down to your side. You can put them up in front of you. Okay, can you give me small circles with your arms out? Okay, can you give me big circles? Okay, so range of motion is good. There's no limitations there. I'm gonna test your bilateral strength. So, put your hands out like this.
Make sure you
Okay, have your hands out like that. Okay, I'm going to push. Don't let me. All right, like that for me. I'm going to pull. Don't let me. Okay, bilateral strength is good. All right, capillary refill. Now she does have colored nails, so I'm gonna have to look at the bottom, your nail bed, to try and get an idea. All right. And capillary refill is less than 2 seconds. Real good. Okay, so now we're going to inspect your tummy. So you're going to lay down for me. Okay. A little lifts, but it shouldn't be on video. Alright, so we're going to assess for color and everything like that. Color seems normal and appropriate for her ethnicity, of course. And then I will auscultate her bowel sounds. Actually, no. Yeah, you auscultate first. So I'll auscultate first before I palpate. So I'll go right upper, right lower, left lower, and left upper. And for the sake of this, we'll say she has normal active bowel sounds. When was your last bowel movement? You can answer that honestly.
Can I sit up?
Sure, yeah.
This morning?
This morning, okay. Was everything normal?
Yes.
Okay, good deal. And was it normal color?
Yes.
It was normal color. Good deal. Okay. And I do still need to palpate, so lay down one more time. I'm so sorry. Just let me know if it feels tender anywhere.
No.
Okay, so now we'll say that was light palpation, so we'll do deep. So I'll go a little bit deeper. Just let me know if it gets tender, okay? Good? All right. So we got that out the way. So as far as we went urinary. Okay. Do you have any issues there? Going to the restroom, number one.
No.
Okay. How has the color been? Normal.
Normal.
How is the consistency? Was it clear? There's no little salt, no powdery, nothing. Doesn't look weird. Just see straight through it, right?
Yes.
Okay. No, I think that's about it right there. And there's no pain when you urinate or anything.
No.
Everything's good there. All right. And you make it to the toilet. You don't have any issues of incontinence, which means you don't use it on yourself at any time.
No.
Okay. You sure? Jokes. All right. So we'll get to the lower extremities now. So you can just hold your legs out for me, please. There is no edema. They are symmetrical. Color and consistency is good. You have any pain in your lower extremities?
No.
Okay. No pain when you're walking?
No.
Okay. Good deal. All right. And then let's see. I'm trying to think. Range of motion. All right. So pretty much the same thing as what we did when it was with your arms. So we'll just, test and see me, make sure you can move them adequately. And this will be active range of motion, so this will be you performing it. So lift your left leg for me.
Oh.
All right. Let's do the right leg. Okay, lift them both. Okay, can you make them in a circular motion? Okay, is there any pain when you do anything like that?
No.
Everything's good there?
Mm-hmm.
Okay, we don't worry about it. Let's try strength. Kind of like the same thing with the arms. So we'll do one and then do the other. So here, give it a slight bend that way you do things. Okay, so I'm gonna push, don't let me. All right, now I'm going to, let's see, give it a little bend. All right, so I'm gonna pull, don't let me. Okay, same on the leg, other leg. So I'm going to push, don't let me. All right, I'm gonna pull, don't let me. Good deal. All right, pedal pulses. Let's go back here, check those out. Okay, we got those. They are equal and they are present. Won't call them bounding. They're present. They're good. All right. Oh shoot. Get back down here. Capillary refill. Of course, her toes are painted. So let's see. We're gonna go with the second toe.
So this is how fast the blood comes back?
Yes. So we press down the nail bed, which cuts off the blood flow. And when we let it go, we expect the blood to come rushing back under 2, sometimes 3 seconds. And if not, then we might have a clot issue or a myriad of other things. We don't want that to happen because that can eventually lead to cyanosis, with it turning blue because of lack of oxygen, which eventually lead to necrosis, which is tissue death. And that's,
your toe cut off?
that's when we chop it off.
Okay.
If you don't chop it off, then you become septic and then you die. We don't want that to happen. All right, so think we made it all the way down to the feet. Skin. All right. So take an overall look. And as I was going, of course, what we were taught really at my job, as you're assessing, you're always assessing the skin whenever you're doing any kind of assessment. So we didn't really have any skin issues. Are there any skin issues that you want to make aware to me?
No.
All right. Do you have acne?
A little bit.
Have a little bit. Do you have eczema?
Yes.
Okay, where is the eczema?
On the insides of my arms and the back of my legs.
Okay, so we will assess that for the sake of
But
the video.
I don't have an active flare-up right now.
You do not have an active flare up right now, and that is evident. We'll see that.
On the side, maybe a little. Not really.
Not too bad. Okay, you can say the back of the legs.
Mm-hmm.
Okay. Gotta get out of there, and I'm gonna get my pen light to help.
I think they're fine though.
So far, so good. Okay, we can work with that. And I'll reassess you again for pain. Are you in any pain?
No.
Are you in any pain at all?
No.
Okay, good deal. Do you have any questions or concerns for me?
No.
You sure?
Yeah.
Okay. That works. So, well, that is it. I think that concludes the physical assessment video. Wish, of course, we could have did it in person in the classroom. It would have been pretty fun. But, yeah, that's pretty much it. Continue to stay safe, and hopefully we see you sometime in the fall, if not in the spring. Do you have anything?
Goodbye.